The GOP's dilemma, rising premiums and the future of healthcare. The ongoing government shutdown has brought to the forefront a contentious issue, the future of healthcare subsidies under the Affordable Care Act, ACA. With premiums rising, the GOP finds itself in a challenging position, facing criticism from both sides. While the party remains united in its opposition to the ACA, a clear plan for the future of healthcare is elusive, leaving voters frustrated and concerned. The first caller's concern. A recent telephone town hall with Maryland Rep. Andy Harris, a prominent figure in the House's Conservative Freedom Caucus, highlighted the dilemma. A concerned citizen, Lisa from Hartford County, Maryland, shared the story of her cousin's disabled son, who is at risk of losing the insurance gained under the ACA. The caller expressed her frustration, stating that her cousin now faces a significant increase in premiums, potentially tripling her previous costs. Harris, a 7-term Republican, struggled to provide a definitive answer. He acknowledged the need to address rising premiums, but offered little concrete plan, predicting negotiations and a potential off-ramp in the future. This uncertainty reflects a broader Republican dilemma, as the party grapples with the consequences of its criticism of the ACA. The shutdown's impact. The government shutdown has intensified the pressure on Republicans, as Democrats capitalize on rising premiums to push for the extension of expiring subsidies. President Donald Trump and GOP leaders have proposed extending enhanced tax credits, but only after Democrats vote to reopen the government. This delay has already led to notifications of premium increases for 2026, causing frustration among enrolled individuals. The issue's growing political strength. As town halls become arenas of frustrated voices, the issue of healthcare premiums appears to be gaining political momentum. GOP Senator Rick Scott acknowledges the inevitability of rising premiums, attributing it to the increasing costs of healthcare and the perceived failure of the ACA. This sentiment resonates with some Republicans, who argue that the ACA has led to fraud and abuse, requiring a broader overhaul of the healthcare system. The Democratic response. Democrats, meanwhile, credit their success in flipping the House in 2018 to the GOP's attempt at repealing Obamacare. They predict a similar outcome in the upcoming midterm elections, highlighting the trust of U.S. adults in their ability to handle healthcare better than Republicans. This political dynamic adds complexity to the GOP's challenge as they navigate rising premiums and the need for a comprehensive healthcare plan. Internal GOP divide. The GOP's internal divide is evident, with some lawmakers advocating for an extension of subsidies and others dismissing such proposals. Brian Blaze, a former health policy advisor to Trump, suggests that maintaining the status quo is destructive. Michael Cannon, from the Libertarian Cato Institute, proposes alternatives, such as expanding ACA exemptions to all 50 states and reintroducing short-term health insurance plans. These ideas reflect the party's struggle to find a unified path forward. The way forward. As the shutdown continues, the political landscape surrounding healthcare premiums remains uncertain. The GOP's challenge is to balance its opposition to the ACA with a practical solution for rising premiums. The party's internal debate and the pressure from voters will shape the future of healthcare in the United States, leaving a lasting impact on the political landscape.